All right, Lyme disease, ready to dive deep.
Sounds good.
Not just the basics, okay?
Well.
We're going way beyond, like, you think you know Lyme disease?
Uh-huh.
What if I told you a lot of people, they don't even get the bullseye rash?
Yeah.
Crazy, right?
Yeah.
Or, get this, some researchers think those, like, Lyme symptoms that linger, it could be because of these persister cells. They're like little bacterial ninjas hiding from the antibiotics.
Yeah. It's pretty wild.
Wild. To guide us, through this whole Lyme disease maze, we've got an expert ready to untangle this with me.
Absolutely. Lyme disease, it's fascinating. It's a challenge. It's like a chameleon.
Exactly.
Mimicking other things.
A medical detective story.
Making diagnosis tough.
Okay, so basics. Lyme disease, bacteria, ticks, right?
Right.
But in that initial infection phase, what do people miss?
A lot of people, they focus on that bullseye rash, right?
Wow, right.
Erythema migrans. But here's the thing. Only about 70 to 80% of cases actually get it.
Really?
So you could have Lyme disease, never see the rash.
And then what happens?
Delays diagnosis, delays treatment.
Oh, that's a good point. It's not just about the rash, right? You got fever, fatigue, muscle aches, headaches.
Yeah, all kinds of stuff.
It could be anything.
Exactly.
So it's mimicking other things, Lyme disease, if you don't catch it early.
Big consequences.
Oh, okay. Like what kind of consequences are we talking? Lyme disease, it's not just short term.
No.
It can progress. What happens in those later stages?
Stage 2, the bacteria spread, more symptoms, nervous system problems, facial paralysis, Bell's palsy.
Whoa, whoa, whoa.
Even the heart, Lyme carditis.
Lyme carditis, that doesn't sound good.
Inflammation of the heart muscle. Messes with the heart rhythm can lead to irregular heartbeat.
Oh, no.
Sometimes severe cases, you need a temporary pacemaker.
A pacemaker, wow. This tiny bacteria can really do some damage. And what if it goes all the way to stage 3?
Stage 3, late disseminated Lyme disease, long-term stuff, chronic arthritis.
Oh, wow.
Neurological damage, impacts cognition, memory, chronic pain.
This is serious stuff. Quality of life just gone.
Yeah, and it's tough to treat at that point.
So cascade of issues, all from this tick-borne illness, accurate diagnosis, timely diagnosis, that's key. But we know it's hard. Why is it so hard to diagnose Lyme disease, especially early on?
Testing methods, primarily the two-tiered antibody testing, they're not always reliable early on, especially.
Oh, really?
False negatives.
So you could have it, but the test
Doesn't pick it up.
oof, frustrating. Why do those false negatives happen?
Takes time for your body to create enough antibodies for the test to see.
Oh, okay.
So if you test too early, false negative.
So you really need that doctor, their assessment, the symptoms, history,
Exactly. Clinical judgment is important.
and even if the test is positive.
Sometimes there's debate about what it means.
Oh, man.
That's a big hurdle.
So much uncertainty. Okay, but let's say we jump over that hurdle. Diagnosis is confirmed. What's the usual treatment for Lyme disease? Easy, complicated.
Good news, early stages, usually treatable with antibiotics.
Antibiotics.
Doxycycline, amoxicillin, oral antibiotics usually work well.
So you take your antibiotics and that's it. You're done.
For a lot of people, yeah, but some patients, they have lingering symptoms even after the antibiotics.
Really? What happens then?
Post-Treatment Lyme Disease Syndrome, PTLDS.
Okay, PTLDS, now we're getting into the weeds. Before we go there, listeners, we'd love to hear from you, Share this deep dive if you're finding it helpful. Tell your friends, family. And hey, subscribe to the deep dive. We've got more explorations just like this one.
Okay.
Back to PTLDS. What do we know and why is it so controversial?
PTLDS, you've got symptoms that stick around: fatigue, pain, brain fog, even mood swings, for months, sometimes years,
Wow.
after the Lyme's been treated. The controversy: what causes those symptoms and how do you treat them?
Okay, so a medical mystery inside a medical mystery.
Mm-hmm.
What are the leading theories about what causes PTLDS?
One idea is that it's residual damage.
From the initial infection.
Yeah, like a scar. Even after the wound is healed, it triggers inflammation.
So the bacteria is gone, but your body's still.
Dealing with the aftermath.
Wow.
Another theory, autoimmune response. The Lyme bacteria triggers it, so your immune system, instead of attacking the bacteria.
It attacks you.
Exactly.
So confusing. And then there's the question, are the symptoms actually from Lyme? Or is it something else, triggered by the Lyme?
Exactly. It gets tricky.
Like untangling a giant knot. And then there's the question of, how do you treat it? What are doctors doing for PTLDS?
That's a challenge. No one really agrees on the best treatment. Some doctors, they want to do more antibiotics, longer courses.
They think the infection's still there.
Right. They think the first round didn't get it all. But a lot of doctors and the research, they say that's not the way to go.
Mm-hmm.
They focus on managing the symptoms. Pain management, physical therapy, cognitive behavioral therapy.
So it depends on the patient, the doctor, what they think is going on.
Exactly. And this is where the chronic Lyme debate comes in.
Okay. A lot to think about as we go deeper. Before we move on, tick prevention, super important. What can our listeners do to avoid those tiny disease carriers?
Know where they live. Wooded areas, tall grass, leaf litter. Ticks love that. If you're in those areas, wear light clothing.
To see them right.
Yeah, tuck your pants into your socks.
Full coverage
Insect repellent, DET.
on exposed skin. What about permethrin? I've heard that's good for ticks too.
Yeah, permethrin, it's an insecticide. Treat your clothes, your gear with it. Kills ticks on contact, no smell, it lasts a long time.
Oh, good to know.
Really good if you're spending a lot of time outdoors.
Permethrin, check,
Mhm.
and tick checks. After you've been out there in the woods, the tall grass.
Absolutely, they're tiny, especially the nymphs. Masters of disguise.
Sneaky little things.
Hit your whole body, scalp, behind your ears, armpits, groin.
There's little folds and crevices.
Yeah, ticks love those spots.
And if you find a tick, what's the best way to get rid of it?
Fine tipped tweezers, grab it close to the skin as possible.
Okay.
Pull up, steady pressure. Don't twist, don't jerk.
You'll break it.
Yeah, the mouth parts could stay in there.
That's not good.
Nope. Once it's out, clean the area with soap and water, put on some antiseptic.
And if you're worried, if you think you might have been exposed to Lyme,
See your doctor.
always a good idea.
They can assess your risk.
Okay, great advice. So we've got a good foundation, I think. The basics of Lyme disease, but we've gone a little deeper too. Prevention, diagnosis, treatment, all important stuff.
Yeah, we covered a lot.
And now we're going to plunge even deeper.
Into the controversies.
It's chronic Lyme disease.
Exciting new research.
The future of Lyme disease. Stay with us. Okay, so let's talk about chronic Lyme disease. It's a big topic, right?
Yeah.
Lots of debate, confusion in the medical world and for patients too. What's at the heart of all this controversy and why is it so complicated?
Well, even what chronic Lyme disease means, that's where the debate starts.
Wow.
Some doctors use it when symptoms stick around after the antibiotics. Others, they don't like that term at all. They say it's more likely PTLDS, those post-treatment complications, not a continued infection.
So it's not just about the symptoms, it's about what's causing them.
Exactly. Is it the Lyme still, or is it something new caused by the Lyme?
That's a big difference.
Mhm.
And how does that affect how doctors treat it?
That's where it gets controversial. People who believe in chronic Lyme as an ongoing infection, they want more antibiotics, longer treatment,
For a long time.
months, even years. But most of the research, it doesn't back that up. And there are risks, antibiotic resistance,
Right.
damage to the gut microbiome.
So you've got two sides, basically. One says chronic Lyme is real, give more antibiotics. The other side says no, manage the symptoms, the infection's gone.
Yeah, it's a tough spot for patients.
They're stuck in the middle. They just want to feel better.
And they don't know who to believe.
Yeah. Who do you trust? What do you do?
It's hard for everyone. Patients are suffering, doctors are trying to do their best, but the research, it's not clear.
So we need more research.
Absolutely. To understand the long-term effects of Lyme and find treatments that actually work based on evidence.
In the meantime, what can patients do?
Advocate for themselves. Ask questions. Get second opinions. Find a doctor who listens.
Someone who will work with them, figure out a plan together.
Exactly. Communication is key.
So the chronic Lyme debate continues, but there's also a lot of hope out there. New diagnostics, vaccines, treatments. What's got you excited?
Next generation diagnostics, that's a big one. Imagine a Lyme test, like a home pregnancy test.
Oh, wow, that would be amazing.
Fast, accurate results. At the doctor's office, even at home.
No more waiting for weeks,
And if you can diagnose it faster, you can treat it faster.
which is so important with Lyme.
Yeah.
What about vaccines? Anything new there?
Researchers are using mRNA technology, like the COVID vaccines.
Oh, really?
These new Lyme vaccines, they could target different strains of Borrelia, give you stronger, longer-lasting immunity.
That's amazing. So the technology that helped us with the pandemic, it could help us with Lyme disease too.
It's pretty cool.
Any other research areas that are looking promising?
Persister cells, remember those?
Oh yeah, the bacterial ninjas.
Scientists are trying to figure out how to kill them, even when they're dormant.
So we can wipe out the infection completely.
Exactly. Even in those tough cases.
But how do you fight something that's basically hiding?
It's a challenge. Borrelia burgdorferi, it's a tricky bacteria.
It changes, it adapts.
Evades the immune system, hides from antibiotics. tough to treat with traditional methods.
So what are researchers doing about it?
They're targeting different stages of the bacteria's life, not just killing the active ones, but also the dormant persister cells,
Ah, okay.
and stopping the bacteria from evading the immune system. A multi-pronged attack.
So you hit it from all sides.
Exactly.
Smart. Any other strategies?
Personalized medicine. Lyme disease affects everyone differently.
Right.
And people respond to treatments differently, too. So researchers are trying to tailor treatments based on your genes, your immune system.
Like customized treatment.
Exactly. Use biomarkers, personal data to make better decisions.
That's really interesting. But is it going to be accessible?
That's a good question. We have to make sure these new treatments are available to everyone.
No matter who they are, where they live.
Exactly. Equity and access, that's crucial.
So Lyme disease, it's changing, it's spreading. What role does climate change play in all of this?
Big role. Warmer temperatures, changes in rainfall, it's expanding tick territory.
So they're going to new places?
Exactly. Places where Lyme disease wasn't really a problem before.
So more cases, wider spread. What does that mean for us?
We need more awareness, especially in those new areas. People need to know the risks, how to protect themselves.
And doctors, too.
Yeah, they need to be able to diagnose and treat Lyme effectively. Public health education, that's key.
So educate the public, train the doctors.
Exactly.
Anything else?
Healthcare systems, more Lyme cases, more demand for testing, treatment, long-term care.
So it could strain the system.
Yeah, longer wait times, more pressure on resources. It's a big picture issue.
So it's not just about the individual, it's about society as a whole. Back again for more Lyme disease deep dive. We talked about those persister cells, right?
Yeah.
The ones that go dormant, hide from the antibiotics.
Like masterminds.
Yeah. Seems like they're a big part of this whole Lyme puzzle.
They could be, yeah. They might explain those lingering symptoms, even after treatment.
It's like they have the answers.
If we figure out persister cells, we could maybe cure Lyme completely. No more long-term problems.
But how do you fight something you can't even see? They're like little ninjas.
We're working on it. Some researchers are trying to develop drugs specifically for persister cells.
To target how they survive in that dormant state.
Exactly. Cut off their supplies so they can't hide anymore.
I like it.
Another idea is to use antibiotics, but combine them with other therapies.
To help the immune system, right?
Yeah, boost its ability to see those dormant bacteria, wipe them out.
So a two-pronged attack, target the persister cells directly, and wake up the immune system.
Exactly. Any promising leads so far?
There are some exciting new compounds. Some of them even come from nature. Plants, fungi, things like that.
Yeah.
Nature is amazing.
It really is. Always something new to discover.
So much to learn.
Yeah.
Okay, so even with all this amazing research, Lyme disease is still a tough one. Prevention, diagnosis, treatment, it all matters.
Yeah.
What are the key takeaways you'd give our listeners from everything we've talked about?
Number one, awareness. Know about Lyme disease, know the symptoms, protect yourself from ticks.
Tick checks, clothing, repellent.
Exactly. Those simple things can make a big difference.
Prevention is key. Always better to avoid it in the first place. What else?
If you think you have Lyme disease, don't wait. See a doctor.
Especially if you've been bitten by a tick.
The earlier you catch it, the better the outcome.
Less chance of those long-term issues.
Exactly. And lastly, be your own advocate.
Yeah, good point.
Lyme disease, it can be confusing, frustrating. Do your research, ask questions, get second opinions if you need to.
Don't be afraid to speak up for yourself.
You know your body best.
Great advice. Well, I think we've done it. We've explored Lyme disease, inside and out.
It's the science, the challenges, the hope for the future.
It's been quite a journey.
It has, and there's still so much more to learn.
To our listeners, thanks for joining us on this Lyme disease deep dive. Stay informed, stay proactive, and until next time, keep exploring.